Hi, my name is Peter No. I'm a full body licensed ART active release technique provider, and today I am going to talk you through a session that I went through with one of my patients, Jessica. As you can see here, I am assessing her range of motion in the toe touch, lumbopelvic flexion, and I went ahead and went in and assessed the way her pelvis moved and watched if it was rotating forward, and also palpated the erector spinae muscles in her lumbar spine. Just trying to get a basic idea of the amount of tension that she has in those areas and if she has any adhesions or restrictions that are holding up that movement. Jessica reported having some symptoms in her calves, and usually when patients present with symptoms in their calves, I'm suspecting that there is uh, some nerve involvement and the sciatic nerve is trapped up somewhere along its track. Here I'm palpating the deep external rotators in her hip, and I'm taking her through the movement to see if there's any structures tensing or if there's anything blocking or not moving freely as I'm moving her leg forward into hip flexion, external rotation, and adduction. Just taking a few passes. And in Jessica's case, I felt a little bit of adhesion between the sciatic nerve and the superior gemellus, so I went ahead and focused my treatment on that particular area. Went ahead and went to the other side. Went in and palpated the external rotators on that right side of the hip and took her through the movement, trying to feel if any structures were tightening or tensing up or weren't moving freely. Just trying to do a few passes to get a feel of the muscles. And on this side of the hip, I felt a little bit of adhesion in that posterior capsule of the hip. So I went ahead and did a couple of passes right up on that adhesion to try to free that up. Had Jessica stand up again, and once again we're retesting standing lumbar-pelvic flexion. And as you can see, she's gained a couple of inches, and the tips of her middle finger are now touching the floor. Right here you see her fingers right there touching the floor. So it's a little bit of improvement since the beginning. Now she's reporting some hamstring tightness, and I'm palpating her uh, the erector spinae group in her lumbar spine again. Had her sit down on the table and went in and did the ART treatment for her lumbar spine, the erector spinae muscles. So I'm shoring the muscles here, and I'm taking her into rotation and flexion to try to get those structures to lengthen as I take her through the movement. So she's in extension, rotation, and flexion, rotation at the end of the movement. did a number of passes all the way up the erector spinae group and all the way down to the iliac crest area. Went to the other side, pretty much doing the same thing, just getting a feel of um, if there's any adhesions or if anything's not moving right, and I'm trying to focus my treatment on that particular area. Again, starting in extension and taking her body into flexion and rotation to lengthen the erector spinae group. Okay, went ahead and had her stand up again, retested the movement. Now you can see that she's reaching even further down and that all of her fingers are actually able to rest on the ground now.